Yes, we are.
If you're wondering why my face is red, it's because I just had a pretty good laughing fit with Charles. Anyway, let me get my stuff set up here so we can see y'all, your comments. What's up, everybody? Aloha Tuesday. I know we're kind of kapakahi right now with the scheduling and so forth, but a lot of things changing now. We're gonna have to adjust and adapt, and lots to talk about tonight. And I want to thank you all for joining. I don't know why I'm not seeing any comments. Hang on here. I hate this thing. Not sure why. Okay, there we go. All right, what's happening, everybody? What's up, Charles? How you doing, buddy? How you doing?
I was doing fine until we had that laugh.
Well, tonight we got an awesome show. Dr. Jonathan Dworkin, infectious. For those of you that think that Charlie and I don't bring on experts, we have an infectious disease specialist, which I consider an expert. Dr. Jonathan Dworkin will be with us in a few minutes. Some big news today, guys. 22 cases on Kauai. You know, Charlie, I am not surprised at all. I am not, as I stated in one of my posts today, I'm not surprised. I'm just very disappointed and concerned with the state's constant minimization of this variant. More specifically, the lieutenant governor. Governor Ige has maintained a safe track, which we appreciate. I'm trying to get him on our show, believe it or not, because I wanna thank him face to face or screen to screen for staying the course. But the lieutenant governor constantly talking about how safe everybody is, even with this variant. And we heard Dr. Berman today on the news say that they're now seeing, no, that's wrong, because we've seen this for months now. But the Department of Health, is now seeing that the Delta variant is much more contagious and has much more severe illness. Now they see that. No, because that theory has been proven months ago, months ago. But we just chose to ignore it because you listen to somebody like the lieutenant governor who tells you, it's like the regular variant. I'm not concerned. So that's kind of where I'm at, bro.
Well, I would like to say there are several tracks of thought that we can have tonight, and I'm going to ask our esteemed expert what he thinks, because there are some things that it is truly baffling me right now. One is, remember when we first started off and we had numbers like what we're seeing right now? The state shut down. But because of vaccination, right? But we're still having cases. That's the oddity of this whole thing. We are still having cases, even with the vaccination. Now, I saw your post. No, maybe the children aren't vaccinated, but man, the young ones in what is that, Mississippi?
I think
Ten,
Missouri. I think it was
that was
maybe
Mississippi,
maybe okay.
but it's 10 of them, all on ventilators, nailed with the variant. So today, and another track came in. I um, I commend our mayor. I commend our Department of Health. I hear the recording every day at the airport. The reason why Kauai was one of the lowest in the United States for a period of time. But a statement was made today that kind of, you ever had one of those moments like, huh? It's called a duh moment, right? Like, huh? Did I just hear what I heard? It was said the majority of the travel related cases on Kauai was due to the fact that local residents traveled and came back and they were infected. I took that to mean, are you saying only local people can travel and get infected? And then everybody else that's traveling don't get infected? right? That's what I took away from it. I said, I don't think that's right. Anybody can catch this variant. Anybody can get infected. Is it just, well, there's no more testing of the travelers because there's no safety net coming into the state. You can carry a fraudulent vaccination card with you and, hey, come on, my, welcome, come, spread your aloha. Isn't that it? There is no foolproof way of finding who's good and who's bad. Now, everything is based on the honor system. Well, we saw how that works because if it worked, truly worked, do you think we would have had uh, Angela Teen and her Hapu breakers in full force? No. If everybody was truly honest and said, we're just truly honest coming into the state, right? And I say, hey, we don't want to spread anything bad. We're going to quarantine, right? But that didn't happen. So you had to have this private group that did a fantastic job. And I know some of these travelers thought that they were rats and all of that, but hey, the hell with you. They're just trying to protect the people of Hawaii. Because guess what? You come over here, you wasn't trying to protect us or you wasn't trying to share with us. I mean, we share what we have here culturally with you that you can take away the experience. But then if you bring something over, that's not what we want you to share with us. So those are my sentiments at this time, Sir Mel.
Guys, share this thing right now because tonight gonna be explosive. Tonight is going to be explosive. So please share this right now. Hit the share button. We need tonight's message to be out. Dr. Dworkin is an expert. Now he has a book that's being published. We want to talk a little bit about that when he gets on. But I wanted to follow up a little bit on what Charlie was saying. A couple of things that are really irritating me. Number one is that the fact that, and I see a lot of posts, you know, and I said this earlier. There's enough blame to go around, whether it's residents or visitors. The reality is this: no visitor is going to take a test if they don't have to, because they know if they test positive, they're going to be stuck here for 14 days or 10 days or whatever the hell it is. You got a little sore throat, you know what? You're going to take Tylenol, you're going to take some sore throat lozenges, and you're going to enjoy the rest of your vacation. You're going to get on that plane and you're going to go home. That's the reality, people. Whether you believe it or not, that's what's happening. That is what the reality. So that is why we're not seeing any visitor unless they get really sick. If they get really sick and they end up going to the doctor and they get tested, then you'll see them pop up. So, but again, it's not about blaming. It's about the system. It's about the process. It's about the system in place, this nonsense, unsafe travel program, which has been promoted as being successful. That is the problem. We saw this the last time we opted in. Our numbers went through the roof. Now we open up because the state said it's okay. Lieutenant Governor said it's perfectly fine. And our numbers on Kauai, remember now, Kauai, 9 ICU beds, guys. I don't want to hear this nonsense about 9. And just think if you're patient number 10 or your tutu is patient number 10. Come on, guys, let's be real. The other thing that's really irritating me is the lack of transparency. We went through this before, Charlie. We went through this with that one few clusters we had, that Rob's and Troy's and Sheraton Coconut Beach, whatever the name is. The names went out. The names all went out to the public. And then we had a church. Oh, we cannot tell you what a church, because church members, they have a good handle on their members, and we felt comfortable that they could reach out to their members and get everybody informed. Well, we know that's not true because not everybody goes to church every Sunday, and not the same people. You get people that go different churches that may not be a regular member. And then we had a restaurant, right? And the restaurant, we're not going to disclose that one. Today we got another church and a care home or whatever it was. This is the way I see it. And this is just the world according to Mel. Whether you agree or disagree, I can respectfully disagree with anybody. We should be informed where the church and when were the exposures. Where's that care home? Where's the restaurant? Where's the bar? Where did these exposures happen, so people can go get tested and people can share with their loved ones and their friends so we can all get an accurate number of the positive cases on our island. How hard is that to do? And how difficult is that? Is that too much to ask? I don't know what the secrecy is. And tell us, out of the 22 cases today, how many were vaccinated and how many wasn't? They keep using the term majority. You know, 6 out of 10 is a majority. No, tell us 20 of the people were vaccinated or not vaccinated and 2 were. Tell the people everything there is to be told so we can make informed decisions. They're out there begging people to get vaccines. Well, when you listen to the lieutenant governor and he's convincing you that everything's all groovy, yeah, go get a vaccine, but wear your mask. And, this is, don't worry about it. We can move on. We can open up. I want the governor to remove the mask mandate now. I want the governor to open up take away all restrictions now. That's what you're hearing from the state. And then you're hearing, oh, Kauai get 22 cases, but you cannot tell us. Tell us that, don't say majority. Tell us 22, 21, 20 of the 22 were not vaccinated, and that's why it's important for you to get vaccinated. Why the secrecy? Yeah, this is not a dig on anybody, Charlie, and for our viewers, this is not a dig on anybody. But how hard is it to just be straight and real with the people? If you want them to adjust behavior, you want them to change behavior, be honest with them. Stop playing this silly game about majority was not vaccinated. We know that vaccinated people get sick. We know that vaccinated people die. We know that vaccinated people, although rare, can still spread, get really sick and die. So just be real, man. That's all I'm saying. That is all I'm saying. And I shared this today with the county, and I hope they take it to heart, because you're begging people to get vaccinated, but yet on the other side of the lips, you're telling them that it's not that bad. And we know, Charlie, you mentioned the Mississippi cases. We see what's happening throughout the country. The shit's real. The shit is real, and we better get a handle on it now. Stop blaming tourists or residents.
I think
We're treating the symptoms, not the core cause, which is the variant itself.
I think, the way I look at things right now, save your energy. We bring out what we need to bring out, and we just let the chips fall where they fall. Because there is nothing you or I can say, yet we can inform the public, right? That's what we're real good at. We inform the public. So so as our esteemed guest is joining us, we're just getting ready to say that we inform the public, because why? When something is said, right? At one time, I think we had one of the best dragnets ever known to mankind, what we did, right? Because we're trying to catch everything at the airport. Right now, all of that has been lifted. And then now people are going, oh, we're getting cases now. What do you think was going to happen? Nothing. So anyway, ladies and gentlemen, it is our great honor and privilege to have the one, the only, the individual who sees with a great sense of humility how to let us know how bad things are, but he puts it in a perspective that we can all understand, because number one, he is a doctor as well, but he speaks the truth. It is our pleasure. It's my pleasure to introduce the one and only Dr. Jonathan Dworkin. How you doing, Doc?
Good, good. It's a pleasure to be here. Thanks for having me, guys.
Oh man,
Let me just add, infectious disease specialist.
Yeah.
He's an infectious disease specialist. He's also an author, which we'll talk about in a little bit. I am so excited for you, Doc. I am. But like Charlie said, we are just so honored and privileged to have you on.
Yes.
I have no clue what you're going to say, but I know our viewers are going to be educated.
This is what I want to say now. If you're looking at this guy, and he's on the Big Island, right? You look at the old style cabinets behind in the kitchen, the old style. That's how I remember growing up when you go in places like Waimea, you go into cold country. You got those cabinets over there, and you'd run in, and when I was small, went to an auntie's house on a Big Island in Waimea. And I always remember telling my daddy, Dad, I like cocoa. and you reach into those cabinets like that. You know the one you got to really reach high. That's why I'm getting a lot of flashbacks and memories looking at those nice cabinets behind you there, sir.
You guys should come over sometime because that's half the reason we got this house. We love this kitchen. And I'm representing the Waimea Coffee Company here too, because they kept me well fed through many ID shifts in North Hawaii Hospital.
Right.
If you're gonna be using sponsors, you make sure they send the sponsor dollars to Mel and Charlie show. It cannot be this kind of free. At least some coffee, man. At least get us some coffie.
We're gonna dive into the gloom and the doom and the delta. I'm gonna have to start putting rum in this cup instead of tea.
Yeah. Bro, I changed. I got away from coffee because it got me fired up, so I started drinking water. Tonight it's full blown. It's a
Whatever.
quad. I'm on fire tonight because I wanted to be ready for you. But I did want to say about that cabinets, and my dad is watching, and he's in Washington, but he knows this. We had those little cabinets. The only difference, Charlie, when we went up to go get the cabinet for Coco, my grandma was there with a wooden spoon for whacking knuckles. You couldn't touch nothing in the Portuguese house. Zero. They whack you. It's serious. Has a heart attack. Right, Dad? You remember that? Not my
And you
dad.
remember
My
one
dad
thing
never did.
too now. Back in the old days when they whacked you with the wooden spoon, for some reason, every wooden spoon had a name like Junior. Keep it up. I'll give you Junior.
That's funny you guys say that because I remember the wooden spoon was a staple of discipline in South Philly with some of my Italian relatives. So that's an international thing, I guess.
Well, I know it's a Portuguese thing. It was so weird because I had two Portuguese grandmas. I'm full-blooded Portuguese. My grandma Raposo, who's my dad's mom, and he's watching, and he says, "Yes, Mel, I remember that." My grandma Raposo was the loving one. She was so sweet, just like my dad. And my grandma Maderas, my mom's mom, whoo, you touch you. Anyway, I'm not gonna say more. She's still alive. She's 103 or 4. So because she still can kick my okole. So anyway, Doc,
Okay.
what the heck is going on, Doc? Are you surprised?
Well, you know, before we get into everything that's not good, and I think we should get into what's not good, let's spend just 1 minute, zoom out, and look at what's good. Paper came out of Yale School of Public Health just a couple of days ago. I don't know if you guys noticed it, estimating the numbers of lives saved, you know, in the first half of 2021 with the vaccine rollout. The number was 279,000 as of about a week ago. So that's almost 300,000 people that are here that wouldn't have been here if the epidemic had continued on the trajectory it was on in 2020. And I think they just did some basic projections based on what we were seeing at the end of 2020 and where we're at now. And it's been an enormous difference. And you can see it not just on that big macro scale in terms of deaths, you can see it, you know, at the hospital level too. You know, this time last year, you know, guys like me, we were going over with a magnifying glass every day, the admission numbers to the hospital. We had at the peak in Honolulu, 100 admissions or more at Punch Bowl. And we were worried that we were going to get overrun, you know, that we'd have people dying in the parking lot, that kind of thing, that healthcare workers were going to start getting sick and get taken out. There was a real siege mentality. That's lifted. We don't have that now. We've got, you know, 10, 15 patients in the hospital. It's less than it was in April of last year when we got hit with the first wave. So this is an enormous difference, and I think we should just acknowledge it. We're not in the same situation we were in. Now, that doesn't mean we're out of it. That doesn't mean that we can just like declare victory and do whatever the heck we want. We're still in a pandemic, and it's still a dangerous pandemic, and I acknowledge that. But 300,000 lives saved is a big deal. I mean, this is a magnificent achievement of science and medicine, and you know, the people who hate vaccines will never come close to touching that number of 300,000 lives saved with any other intervention that they would propose that we do instead. So let's just start with that, and then we can get to pressing, of course, if we want to. So I know there's a lot of issues that have come up with Delta.
Mm-hmm. Well, let me ask you something that I'm kind of, you know, doing a comparison, and I'm glad you used those numbers and that comparison that you just did. But there seems to be, because of vaccines, but there seems to be no fear at this point. And the thing that I dread is because there's no fear, there is more chances taken. Yeah. And that's what it seems like. So the numbers, though it may be hidden, I'm fearing now more than ever that it'll populate and explode at some point because so many chances are being taken at this time that you would never see before. And so
Yeah.
this time around, before you came on, I asked Mel, I said, you know, people are taking so much chances. Uh, they're looking at this like the flu, and yet we're continually getting cases, but yet the Department of Health does not want to reveal whether they've been vaccinated or not and where it is. So it's like saying, hey, I want you to take care because we have a loose maniac that's going and shooting people. Well, why don't you tell us where was the last time he discharged his weapon? So at least we know he's in my neck of the woods or he's not.
Yeah.
They're just saying, they're just giving us a blanket statement. And I think that's why they said, you know, people, I've heard this several times saying, you know, maybe it pertains to us and maybe not. So you know what? Why live in fear? Let's just go for it. And that's the danger of it all. That's what am I kind of seeing something that you might be seeing, Doc? Or
Yeah. I mean, it's weird because we get used to thinking about the pandemic in a certain way, and then it changes on us. And it's been like this from the very beginning. You know, people who get stuck in one kind of reaction often end up being out of date before they even realize it. And we have to be flexible. And, you know, one of the things that I liked about Mayor Kawakami several months ago was he refused to get stuck. He said, you know, I can't promise I'm going to do something one way this month and then I'm going to keep doing it the same way the next month. I think he understood the way a pandemic works better than some of his critics did. There's no virtue in being consistent when you're in a boxing match. You know, the virtue is not getting knocked out, and we have to be able to shift with conditions. I think for me, with the Delta variant, the big question that I've been asking myself as an ID doctor is like, is this fundamentally different? You know, are we in a fundamentally different situation now than we were in a few months ago? And if so, in what way are we in a fundamentally different situation? And that's what I've been kind of wrestling with. And, you know, when I'm reading articles, that's kind of the background question in my mind. And when I'm talking to other people, other doctors, epidemiology people, we've got some excellent epidemiology people in Hawaii. That's what I'm trying to drive at. You know, individually, Charlie, I don't think it is fundamentally different yet because, you know, we have some reasonably good data on the vaccine efficacy, particularly against severe infection. And you remember when we talked before, we talked about vaccines. We said, well, what do we really care about with the vaccine? Number one thing we really care about, does it prevent you from getting intubated? Does it prevent you from getting dead? That's the number one thing we care about. Mortality is always the king's coin in medicine. And the vaccine appears to be not perfect, but still very good in terms of preventing severe infection and mortality. If you look at who's coming into the hospital in danger of death, close to death, it's almost all unvaccinated. That's what I've been seeing here on the Big Island. That's what my friends in Honolulu are seeing. It's an epidemic of severe infection amongst the unvaccinated. Okay, there's other things we care about, right? Other things we care about are things like symptomatic infection. Are you going to get sick and then be wiped out and be home for weeks, have it ruin your gathering or your travel or some other thing that you wanted to do? Well, it's probably not as good for that. We have lower numbers coming in. We have data from Public Health England, you know, was something like 88% effective, not quite as good as we were seeing before. The Canadians did some studies, and the one that I saw from them, it was about 85, 86%. The Israelis had theirs in the high 60s, but I haven't seen their data yet. That was not as good a number. But I suspect it's a little lower than what we were talking about a few months ago in the low 90s. It's more like 70s, 80s, most likely. And alongside that, we're getting these anecdotes, right? We're hearing about clusters of cases in vaccinated people that are kind of alarming and concerning. One paper that just got posted was a wedding in Texas where they had rules. It was all outdoors and everybody was vaccinated, which sounds like the right way to do a wedding, right? And despite that, they had a handful of cases amongst vaccinated, fully vaccinated people. So that strikes me as a little bit different. We don't have the denominator data from that wedding to know how many people total because they didn't screen everybody, but it was something that was alarming. And then the other thing we care about, and you talked to me about this before, Charlie, was asymptomatic transmission. And the question, you know, back in March was, okay, so you're protected against being killed, but are you going to pass it along to somebody without even knowing you're passing it along to somebody, right? And there it might be even worse. We don't really know. And part of the reason why we don't know is because we're not routinely swabbing people after they're vaccinated. And I think we should be more, we should be trying to get better data on that. But there are some very smart people who think that that's a major problem. You look at the University of Washington, Chris Murray, who's the head of IHME. They do the big modeling for UW. He's looking at the data from several different countries, and he's saying there's no way we'd be seeing case surges in these countries if there was not transmission amongst vaccinated people. Just, he can't figure out mathematically how it would work. So he suspects that there is, and if we look for it, we're going to find it. So I think that there are some signs there that are concerning, that maybe don't affect so much what you do individually, but sort of affect the shape of the epidemic globally and what we can expect going forward, if that makes sense.
No, totally.
I think Israel is, for me anyway, it's proof enough that the transmission still occurs in vaccinated people, because their numbers were quite high, vaccinated residents, and their transmission rates are climbing. So I think that's something we just got to accept, that in fact it is possible, and we cannot ignore that fact. And I think in many times that I've heard our state say that you don't have to worry about it. Once you get vaccinated, you're safe, you're totally immune, and we know that's not true. So I'm concerned going forward that more and more transmissions that occur, like right now, 22 on Kauai. We don't know how many people those 22 people came in contact. I mean, we're going to try and do the best job we can in contact tracing. But the fact of the matter is, Doc, and we spoke of this before you came on, was the number of testing. We're not testing as much. Visitors aren't getting tested. We have asymptomatic carriers. There's no way you can avoid that. That we'll never know because they never got tested. They never. If you're a visitor here on Kauai and you know that if you take a test and you get positive, your vacation just got extended. You got to go pay another 14 days of hotel. You got to be confined to your room. You got to have food brought in. I don't know, unless you're very ill and you got to go to the hospital. I don't know if too many tourists is going to go take a test.
Yeah, that's right.
I don't know. What's your thoughts on that? I mean, I think right now everything is resident travel, returning residents. But because we're not testing, so we don't know how many visitors actually have the virus.
Yeah. I mean, we talked about this before, but there were a bunch of attempts to pin down, what the transmission risk was from travelers that date back to earlier in the safe travels argument. And I think you guys would know better than me because you're on site. But it seemed to me like the decision on Kauai was, okay, we're gonna rejoin safe travels when we hit a certain vaccine threshold. We want to see X number of people have access to vaccine, and that was April 1st or around then. And in my mind, I thought, okay, that's when Kauai's going to start seeing cases. It never occurred to me that anything else was going to happen other than that. Mm-hmm. And ultimately, it's a question of what a place is willing to tolerate. I think Kauai did a better job than any other island in keeping it out at the time that it was most dangerous. And I give Kauai a lot of credit for that. I think that was absolutely the right thing to do. It was not the prevalent view amongst the other counties, and there was a lot of flack that the leadership of Kauai caught for that. And I think when people look back on this epidemic, they're going to see that Kauai had a much better epidemic in 2020 than the rest of the state did. And that's actually in my book, which we'll talk about, I guess, at some point. But there's data on this, and I think Kauai did exceptional. Now, once you open up, then it's you're just like every place else, right? So you're going to get all the same problems that all the other islands have. And we know that people. What I see here, anecdotally, is people are traveling. They know they need to take a test before they come back. They take their test, then they go do their social event, then they get on the plane, and then they come back, right? Or maybe they don't get the highest quality test, or maybe they get infected in transport, waiting an hour in the security line, or in ground transportation, and they're getting symptomatic 2-3 days after they get back. And there's also a latency period for the virus, and this has been worked out. And there's a really good study out of China looking at Delta specifically, where they were actually able to pin down, Tim Brown just sent it to me. It was a great study where they were actually able to pin down exactly what the latency period was, because it's Guangzhou, China. So the government tells you to do something, you do it. So they had an outbreak at Delta, and they did things that we could never do. They did 30 million PCR tests in a couple of weeks. People got put on centralized quarantine. They got tested every single day while they were in centralized quarantine, regardless of whether or not they had symptoms. So they knew exactly when those people were exposed. They knew exactly when they began to shed virus, and they knew exactly when they began to get symptoms. They had it all plotted out in this little paper. And what you see is exactly what we've been saying the whole time about safe travels, is that there's a latency period. With Delta virus, it was with Delta COVID, it was about 3 days, and with the older one, it was more like 5 or 6 days. And another interesting thing was that with Delta, the viral load was about 1,000 times higher, 1,000 times higher. So every milliliter of gullah, there's 1,000 times as much virus in it. So it's extremely contagious,
Wow.
extremely fast moving. And there's some other data, from other places. Singapore did a very nice study. There's some stuff out of the UK too that shows that it might be more severe. You would expect it to be more severe. Viral loads 1,000 times higher. But the rate of severe infection requiring hospitalization, requiring ICU care was, anywhere from 1.5 to 2 times higher. So, if all you're relying on is a single pre-travel test, you're going to have Delta, and we have Delta. It's here, guys. I mean, we know it's here. There were sporadic cases, but I'm confident that there's a lot more of it here already, because those state lab reports lag a few weeks, and I wouldn't be surprised if it's already the majority of infections or close to it.
Well, I'll tell you one thing. That gentleman from the state lab, when he gave the news that, it was worrisome. When you look at him, because he has a very hard time hiding his emotions.
Yeah.
And so what I saw in his face was nothing but fear. And I said, oh, well, let's just change the channel, because he's already telepathically telling me what he knows, but just due to political reasons, he just can't tell us right now.
It's because you're a cop. He's afraid. He knows you're going to get the truth out of him.
But let
Well,
me ask
we both picked up on that, and it was clear that he was concerned. We know that we're not testing every sample, but we know that the majority of samples that we are testing, and I did hear this, was the variant. And that I agree with you, Doc, that it's got to be the dominant strain now here in Hawaii. It has to be.
Yeah, and if you look at how the variants arrived in Hawaii, you see this very stepwise progression where the border control directly correlated with the order in which it arrived. So the first variants that got here were California variant, and they arrived in Maui and Oahu, which were in safe travels without really any modifications. And then, with the next reports, you see some variants on the Big Island. You guys remember the Big Island had post-arrival testing, but that testing was done on the day of arrival. And we didn't catch a lot with that testing. It was rare to catch positive. But what I saw in the hospital was people getting positive 2 or 3 days later after having a negative post-arrival test at the airport. So it may have just been that interval wasn't sufficiently long to catch the majority of people. But I think it did delay it a little bit, because we had fewer variants here than Oahu and Maui did. And then Kauai was the best, right? Because you just had the 14-day quarantine with no BS, right? But as soon as that gets lifted, everything on the mainland is coming your way, right? And unless you're going to do a really rigorous border control with a forced quarantine and a post-arrival test day 5, day 7, something like that, to catch those people, even then you're going to get a few slip through, but you'd have fewer slip through. And whether or not to institute something like that, is essentially a political decision, right? I mean, it's got huge implications for, mobility and the economy and whatnot. I would be supportive of it, of course. But it was a tough sell. Even to get a post-arrival test on the Big Island, it's hard to do, hard to maintain. And that was just at the airport.
Okay. Hey, Doc, I wanted to find out, and I've asked this question so many times, but given how this whole variant situation has evolved, today on the news, I'm looking at the positivity rate went from 1.4 and now jumped to 2.4. And one news coverage covered that gentleman who's head of the, I guess the medical hospital field or whatever. He's saying that this variant is transmissible by over 200 something percent, meaning the thing is like you said, it's very, very dangerous. So tell me, if you can, what makes up this variant that is so different from COVID itself when it first came on the scene, that makes this thing the big boogeyman that we should be concerned about?
Well, that's a really good question, and not a super easy one to answer. I mean, the mutations that are relevant appear to be mutations in the spike protein. So, the business end of the virus, right? But, as is often the case, the thing we were worried about was not necessarily the thing that ended up happening. So early on, everyone was worried about vaccine escape variants, and I was reading all these articles on like plaque reduction essays and all this esoteric stuff. Oh my God, this one's, you need 5 times the titer to neutralize it versus this one, you need 2 times the titer to neutralize it. Well, the virus had other plans, and its strategy was just to make itself a whole lot more contagious. And that seems to be the principal difference. The vaccine escape is not much greater than the other variants. In fact, it might even be less than the South African variant 51 that was going around before, but it's way more contagious. And again, it's these mutations in the spike protein that we think just make it a lot stickier to human cells. So it's a lot more efficient at getting in. And if you took, the original Wuhan coronavirus, the original strain, that was already a contagious virus. That was more contagious than flu. We thought it was probably about twice as contagious as flu, something like that. There were different estimates, right? The UK variant, which was the first big variant, was about 50 to 60% more contagious than that. And this Delta variant, which arose in India, appears to be 50 or 60% more contagious than the UK variant. So if you do the math on that, you get a transmissibility that's something like 5 to 6 times, or maybe even more contagious than influenza. You're getting into like smallpox range level contagiousness now. I mean, this is extremely contagious. And with those viral loads that are 1,000 times higher, this in and of itself is an evolutionary strategy. It's like, okay, you guys can vaccinate, but there's just going to be so much virus pouring out of these people who get sick that it's going to rip through the unvaccinated population. And then people who have been vaccinated, even though they're protected, it's not going to be perfect. There's going to be some breakthrough there too. And my big question is, with these big surges in cases, how many of these are unvaccinated people? Is this really just the epidemic ripping through the unvaccinated because it's so contagious, or is this instead, what we're seeing more like vaccine failure, where we're seeing more breakthrough? And I suspect it's probably a little bit of both. I think mostly, what we're seeing in the hospital with severe illness, it's almost all unvaccinated, and then rarely an occasional vaccinated person too. But I wouldn't be surprised if we find that breakthrough is more common, and that especially some of these people that maybe didn't have a great immunologic response the first time, they were immune compromised, they're on steroids, they're rheumatology patients getting immune suppressive medicines for lupus or rheumatoid arthritis, or they're cancer patients getting chemotherapy, or they're just old and their immune system isn't responding quite as vigorously as it would have when they were young. These people are going to be more vulnerable to breakthrough. And I'll tell you one more thing, because this is kind of cool, and it got inside my head and freaked me out a little bit. So Queens has this cool study they do called Quasar, where they, if you're a healthcare staff at a Queens hospital, every 6 months they call you and they draw your blood and they check your antibodies. And prior to the vaccines, they just were looking to see what percentage of the healthcare staff had been infected, basically, with a way of keeping track of that. After the vaccines, they added a second antibody. So now they check 2 antibodies. One is an antibody that's specific for infection. It's not spike antibody. It's antibody against a different part of the virus. So that tells you whether or not you've been infected. The other one is looking at spike antibody, and that tells you vaccine status. Someone who's vaccinated is positive for spike antibody, but negative for the other one. So I went in and got my titers checked, and they give me this number. And I get this thing in the email, and it's like, your number is 14. 14 what? 14 is the concentration of the antibody in my blood. And I'm like, well, that sounds all right. So then I call them, I'm nerding out to this stuff. Hey, it's 14 good? And the answer is, we don't know. We don't know how to interpret that number. There's no data on this at all. Where this is this research study. You're how we're figuring this out. I'm like, okay, great. Show me all the other numbers of people who've been vaccinated. It turns out there's a spread, right? And some people had no antibodies at all. right? And some people had, less than 50. And then some people had like 50 to 100. And a lot of people had greater than 250. 250 was the higher cutoff. So I'm like, wow, 14 kind of sucks. I'm in that lower 10 percentile or whatever. And I remember when I got the shot, everyone was saying, oh, you're going to flu, you're going to be down for 2 days. I had nothing, guys. I was trying to play it up so that I could get some sympathy with the family and not have to like do chores and stuff, but I couldn't. I was feeling fine. And it turns out I didn't get a great antibody response. So am I more likely to have a breakthrough infection? I have no idea, because there's lots that goes into immunity aside from a number like that. But I think some of these people with low titers or other immune deficiency issues are going to get sick. It's going to be part
Well,
of it.
I've always said, for some of us that didn't have symptoms, I said, hey guys, don't be surprised. I know you got vaccinated, but I hate to tell you a little, but I'm going to share a secret with you. That was sugar water.
Hey, Doc, I want to kind of go back to Charlie talked about the positivity rate. This is as of the 11th, so it's 2 days ago. Kauai's number obviously hasn't been updated. But if you look at this, how much of a concern is it for you when you look at the positivity rate look at Hawaii, the Big Island, up 87%, new cases up 87% over the last 14-day period. Hawaii, 194%. Our positivity rate is at 3.6. Again, this is updated as of Tuesday, July. Oh, I'm sorry. It just changed. Data. I'm sorry. Data as of the 11th. So we're missing 2 days of data. But
Yeah.
does this concern you? I understand that the level of sickness on the vaccinated people are somewhat lower than unvaccinated, but does these numbers, should we be
Yeah.
concerned?
Yeah, I'm pausing because I'm trying to think here. Early in the epidemic, I looked at test positivity very carefully every day, and I've stopped doing that in recent weeks. But it's generally an indication that you're not doing enough testing, right? Because you want to be catching the virus, and if your test positivity is going up, that indicates that you're probably not testing enough. There's probably people out there that have it or spreading it that you're not catching. And early in the epidemic, testing was like the primary tool that we had to control the epidemic. We were just testing everybody as much as we could. I mean, I was somebody who was like, we should test everybody all the time, and some of my colleagues hated me because not everyone agreed with that strategy early on. It was fairly contentious, but there were some very bright people, at UW, at Harvard, at other places that were saying, no, we need to test the crap out of everybody. And they wanted to roll out rapid antigen testing, and they wanted to basically have everybody getting routinely tested as a way of locking down and identifying infection and then doing contact tracing and getting people out of circulation, right? After the vaccines came out, a lot of the public health authorities lost interest in testing. It all became, let's vaccinate everybody that we can vaccinate. And I think that might have been a mistake, personally. I think there's still a role to be played by doing rapid antigen testing at scale. And particularly as we get different variants coming in. I mean, you could use rapid antigen testing to make things like air travel safer. You could use it to make things like schools safer or conventions safer, or hotels safer. But you would have to have the political will to do that. And a lot of those businesses weren't really interested in doing it because I think they were afraid of what they might find. They would have to set up testing programs. And then if they got positives, deal with the positives. And if you're doing wide scale testing, you're going to have false positives. So you got to figure out what to do with that. So it's just been de-emphasized, but I think, yes, we should be testing more. And I would like to see it really concentrated in areas where it would be the highest yield, right? So where are we seeing cases? Any crowded indoor space, make it safer. You could do testing. I think there's still a role for it in travel, although that's become, nobody's interested in that. What are we up to, 20, 30,000 visitors a day now? So
30,000.
Yeah.
We hear a lot of talk about the booster. We're hearing that, in fact, Israel has already started giving booster shots. There's concern that from Pfizer, I know you're aware of this, that Pfizer is saying, hey, we're seeing a waning of the effectiveness of the vaccine. after 6 months, CDC and FDA saying, no, we don't see that yet. It's kind of premature. But it wasn't long ago, Doc, and I think you validated this as well, that it was quite a common understanding months ago that a booster would probably be required. What have you read, or what are your thoughts on the booster?
Yeah, there's two reasons why it would make sense to do boosting. One is that the immunity from the shot is waning, right? So that you have this issue of antibodies, or there's other ways of measuring immunity, T cell response, whatnot, is wearing off. That was a concern with coronavirus in particular, because seasonal coronaviruses, non-COVID coronaviruses, tend to reinfect people every few years, and they're sort of part of the circulating, ecosystem that we're all in. So the concern was, oh, we're going to, you're giving somebody a shot for what's essentially like a cousin of a common cold virus. Is it going to be like the common cold, and you're going to have to repeat this every year? And that was a concern. So that's one set of concerns. The data on that's actually been pretty good. I mean, initially, everyone who was booing the vaccine effort was saying, oh, you only have 2 months of data. What's going to happen the third month, the 4th month? Well, then we got 6 months of data back in April, and that looked pretty good. And now Johnson & Johnson released 8-month data, and that looks pretty good. And there's some other stuff looking at lymph nodes in people that have been vaccinated, and that looks really good. So I don't think that the vaccines are bad in that regard. I don't know yet how long they're going to go, but the duration appears to be at least pretty good. And I suspect it's going to be good. The other reason is you get a variant. And I always thought that was the more likely reason why we might need a boost. And that just comes down to the fact that, we're all on the planet Earth here. And we might like to think that we're just in America or we're just in Hawaii, but there's a whole world around us. And, we rolled out this vaccine program in early 2021. And in the countries that had access to the vaccine, they knocked the epidemic down very nicely, right? We saw the tremendous success, which those Yale numbers reflect, the 300,000 saved lives. There was a similar analysis in the UK, tens of thousands of lives in the UK saved, right? But they're not on planet Pluto in the UK. They're on Earth, and now they have variants coming in because their people travel and our people travel. And there's these places that were just totally neglected in 2021. And if you're the president of the United States, you better be thinking about this. I mean, we need to lead a vaccine effort that gets to everyone. There's billions of people that haven't accessed this stuff yet. And we're not going to be able to put up a wall around ourselves forever, and it's not going to arrive. So I think is Delta variant the one that's going to force them to do a booster? I don't know yet. The whole thing with Pfizer was kind of entertaining, because the Pfizer CEO went on TV and was like, "Oh, we're gonna submit our data for a booster." And I think the feds very appropriately shot him down. And we're like, "Hey, that's a conflict of interest. We're the ones that decide the public health question whether or not we need a booster. So you shut up and wait for the science, and wait for us to have our meetings." And there was this little smackdown that happened with the Pfizer CEO. But that doesn't mean he's wrong, right? I mean, we already have some signs here that the vaccine protection is not as good for this variant. And what I'm hoping that the federal government is doing is thinking about the booster shot, but also thinking about the global vaccine campaign and how they can sync those two things, right? Because wouldn't it be nice if we rolled out a booster and we also rolled out a really comprehensive campaign to vaccinate the developing world that included the predominant circulating variants there? I think we're more likely to have sustained success if we can operate on that scale, and if we can synchronize the effort. Otherwise, we're going to be constantly having to boost, because there's going to be stuff coming in from God knows where with the people that we've neglected. So it's going to force all kinds of people that don't like each other to cooperate with each other now, and that part's going to be kind of fun to watch, I think.
Well, I look at this thing as well as similar to one of those large buoys out in the ocean. We can't have all the buoys in one area, and you can't have them all over, but, they strategically put them out in the ocean. So at least we know that if something is brewing out there in a wild blue yonder, that, we'll get early warnings that, hey, it's moving towards your area or moving towards the West Coast. So that's the way I look at this thing. But someone had asked, mixing of vaccines, is it a good idea?
There was again, there was some data, I think, from the UK, where they looked at that, and they looked at antibody responses. And in the UK, I think it was AstraZeneca and Pfizer were the big two. So there were various combinations. Did you get 2 Pfizers? Did you get 2 AstraZeneca? Did you get an AstraZeneca and then a Pfizer? There are a number of countries that have mixed vaccines. There was a pause on AstraZeneca at one point. It's kind of it's not licensed in the United States, but the one in the United States that's a similar technology is the Johnson & Johnson vaccine. And there was a pause on AstraZeneca, and not every country resumed it. Some of them switched over to Pfizer. So you've got places like in Western Europe where they did their first rounds of shots AstraZeneca, and then they did their second round Pfizer. And then I think in the developing world, it's a bit of a free for all. I mean, people are using whatever they can get their hands on. I think it's probably going to work fine. I mean, that paper that came out of England showed it would work well. And there might even be some advantages to it. I don't know, but I don't think that that's going to be an issue. Frankly, I mean, I would like to see a little bit more data on it, but it's already happening in a lot of places, and it appears to still be protected.
Well, let me follow up with this last question. When we started in the beginning, there was this big, I guess, I want to call it a scientific anomaly where we had to have special refrigeration. So just that alone made it so special. Like, hey, I got to get my hand on that one. You know what I mean? But for someone that doesn't understand how it works, all I saw it was, they're making it difficult because it has to be temperatures that you'll find in the up in the Antarctic, or on top of Mount Everest or whatever. So when all of that came out, and then over time, you notice that the temperature started to rise a little. They said, well, it doesn't have to be that cold. And it just kept on rising and rising to the point like, okay, so where are we now? And it almost seemed like just one big, I took it as a scare tactic. They say, you got to have it at this temperature. And I understand why. But the effect, it doesn't seem like even with warmer temperatures, it didn't seem to affect the effectiveness of these vaccines. Right?
Yeah. The one that really required like a super crazy cold chain at the beginning was Pfizer, and I think it did get relaxed. I don't have the exact numbers in my head as to what it's relaxed to now. I mean, the one that we have at clinic here in my primary care clinic in rural Waimea is Johnson & Johnson, because that one just requires a regular fridge, right? Mm-hmm. Just a plain old fridge. It's like 40 degrees or something, and it's super convenient, and it comes in these vials, and there's 5 shots in the vial. And I feel like Johnson & Johnson is like the ugly stepchild of the American vaccine program. Like, everybody hates it. Maybe in part because it didn't have that like moxie, it's got to be super cold, but also it was the third one that got approved. And then there were some issues with it. There was the rare blood clot issue, which was like 1 in 100,000. And now there's the Guillain-Barré issue, which is also like 1 in 100,000. And people aren't very good at math, and they freak out about these extremely rare side effects. And I'm like, guys, that's a sign that the system is working. Like, if they're picking up a 1 in 100,000 side effect, that means the safety monitoring is working. You're catching these incredibly rare side effects, and then you're reporting them, and you're pausing, and you're analyzing them, and then you're resuming. It's a pretty safe vaccine. And it's great for a rural primary care clinic like where I am. We keep it in the fridge, and somebody wants it, it's there, and they're done. One shot. And these are the people that tend to be a little bit more suspicious. And that's why it's July and they're just coming around to getting their shot. And I don't want to have to chase them down and worry about whether or not they're breeding a variant because they didn't come back for their second shot. So, and it's just peace of mind. You're done. You might have some symptoms for a day or two, and then you're done. And I've used it on patients, and then I've had them say, "Oh, actually, my family member come over. Can we get that person too?" So then we end up, vaccinating 3 or 4 people because they've all just decided, okay, today's the day we're going to do it. So you can get that vaccine out into really rural places very easily. I think the other ones do still require a bit more of a cold chain, but it has been relaxed. Yeah, it's definitely been relaxed.
Hey, Doc, I just want to touch on this last topic before we get into your book, because I do want to get into your book. But what are your thoughts on, this whole herd immunity thing? And I want to get into the debate about what number it is, but the governor has said at 70%, which is probably unlikely, but 70%, all restrictions will be dropped. We know the lieutenant governor is urging the governor to do it sooner. He's urging the governor to remove the indoor mask mandate. What are your thoughts with this variant now? And we're seeing more. And, you know, Kauai has always been the model. They use us as the guinea pig. I don't care. But we're seeing the increases in cases since we opened up. What are your thoughts about this herd immunity thing and opening up, completely opening up when we reach 70%?
You know, as is often the case, we're having a political debate on television, and then the circumstances change and they make the debate look silly. And how many times has that happened, you know, in this pandemic? You know, a couple of months ago when that argument began, and I was privy to some of it, I was talking to some people at the Department of Health, but behind the scenes there. And, you know, what was on the table at that time was, well, let's just open everything now. You know, we've hit 40, we've vaccinated the elderly and we're heading towards 50%. Let's just open it all right now. And there was this sort of panic of like, wait, that doesn't seem like that's smart to do. How do we define when to open things up? And nobody knew exactly how to define when to open things up. So, you know, in the end, I think the Department of Health and Libby Char, who's the director over there, said, you know, I want to see at a certain percent vaccinated, and I want to see the numbers looking better. And that's the cutoff. And I think that was sensible. I mean, I support her on that. I think that was better than the alternative, which was nothing. That was the alternative at that time. That was all before Delta. So now we've got Delta, which is more transmissible. And I'm asking myself a slightly different set of questions. And, you know, one of the questions that I'm asking myself is, do I want to walk with my unvaccinated 8-year-old into a supermarket and everybody's got their masks off? Not really. I don't really want to do that, you know. And so I'm like, okay, so do we wait for kids to be vaccinated before we do this? What about immunocompromised patients? You know, do we wait until we have clarity on the booster issue for immunocompromised patients? Do we wait until our epidemic is lower? It looks like it's going up a little bit right now, you know, most of the islands, right? And then there's the question of what about that 20% of the population that is not vaccinated, that won't be vaccinated, you know, because they're down some YouTube rabbit hole or for whatever reason. And how long do we keep masks on forever, even after all the kids are vaccinated and we boosted everybody to protect that 20%? That seems a little crazy. So at some point we're going to have to open up more. But I think we should be flexible about where we draw the line, and it might have to shift. I think 70%, it was a more conservative number than most of the country, right? Most of the country followed the CDC rec and just took masks off, and now they're getting crushed. And I was complimenting our DOH the other day. I said, look, you guys resisted that CDC pressure, and how smart you look for resisting it. I mean, look what's going on in places like Missouri and Tennessee right now. That could be us. It's not. So it might need to shift again. We're not close to 70%, so I think it's months away. And I'm glad that they are maintaining the indoor mask rate. As soon as we take masks off indoors, we're going to see a surge of cases. There's no doubt, and it's going to be Delta. And it's going to be like it's going to be a little bloody when it happens. So I'm happy to wait on that one until we have more information.
Wow. Yeah. I mean, I think we share your concern, and we're not doctors. We just read and watch experts on the news and on YouTube, and you know, we go down a different YouTube rabbit hole, one of facts. And so anyway, speaking of reading. And I know we had so many questions, Doc, that we cannot get to, but I did want to cover your book. And so now you're an author, and what happened? What do? You just all of a sudden woke up and said, "I'm going to write a book." I already made it. I became famous on Mel and Charlie's show. Now I'm going to write a book.
Yeah, you guys created a monster. The book is called Plague Doctors, and it's coming out in the fall. And it mostly covers the first year of the pandemic, you know, from my perspective as an infectious disease guy. it kind of zooms in and it zooms out a little bit. So I start with a little discussion of the history of epidemics in Hawaii, and which in my mind is the context that defines everything else. Horrible thing that happened to the native Hawaiian people, which was an infectious disease disaster, and how the monarchy, in its wisdom, actually created the Queen's medical system, the Queen's Hospital, as a response to that. And here I am, an infectious disease doctor 150 years later, walking through Queen's Hospital, looking at the portrait of the Queen on the wall, when the next big pandemic hits Hawaii. And I'm thinking to myself, I got to step up. Like, it's on me. She built this house, and here I am. And I got to do what I can to protect the state as an ID doctor. So the story, tracks me through the hospital, and some of it is the clinical stuff I was seeing as a consultant, as an infectious disease consultant at Queens. But then there's also I zoom out a little bit and I discuss some of the broader things that were happening in the state. My interactions with the city and county, my interactions with the Department of Health, the governor and the state's people. It's all in there. And the book kind of, it'll zoom out to the national and the international scale, but then it zooms right back into the Hawaii. And what I really wanted to do was tell the story of Hawaii in the pandemic, and hopefully in a way that's entertaining and engaging. And I want the reader to feel like they're kind of riding shotgun with me through the chaos at the beginning of the pandemic.
I did want to share with you, Doc, that we have a lot of viewers tonight. Interesting when the book comes out. So you say it's coming out in the fall. Will it go to Amazon like most aspiring authors, writers, getting it out there and letting it get to the bestseller list on Amazon? Is that
I was very lucky because publishing is not an industry that's aged well with the internet, and it's hard. I didn't know this before, but apparently there were dozens of publishers in Hawaii in the 80s and 90s. Hawaii was a very book publishing heavy state at one point, and now we're basically down to like three independent publishers in the Hawaiian Islands, because of Amazon. And I was very lucky to get put in touch by a friend of mine, Robert Perkinson, who's American Studies professor at UH, put me in touch with Roger Jelinek. And Roger Jelinek is one of those guys who's at the center of book publishing in Hawaii, and runs the Hawaii Book and Music Festival, which is sort of an arts and literature festival for the Hawaiian Islands. It comes out in the fall. And he kicked my butt, man. He got me into shape, and did a lot of editing with me, and just helped me make it more professional, because I'm a clinical doc writing a book. So it's much more polished because of his influence. And he also was able to introduce me to George Engbritson at Watermark, which is one of those local publishers. So it's gonna be published by a local Hawaii publishing company, Watermark, and hopefully it'll be featured at the Hawaii Book and Music Festival in October. And I'm excited about it because it's going to be a conversation starter about what did we do well, what did we not do well. Fundamentally, I'm pretty optimistic. I even in the darkest days of the pandemic, the thought that we were going to get crushed by the virus, I never allowed it to infiltrate my consciousness. I always thought, well, there's something we can do this, we can do this, we can do that. There's always something we can do to make it better. And I think we did. I think we made it a lot better in this state than it otherwise could have been. There were a lot of people last spring who were going to just let it rip. And if we had listened to them, we would have had thousands of dead people. And we didn't. And Hawaii succeeded in some magnificent ways. So that's part of the story. And then I'm also pretty honest about what I think could have been better.
So let me ask you then. We're all excited. I tell you, we're all excited to see it. But I'm going to ask you on a personal note. Did you write anything about me and Mel in that book?
Yeah, you guys are the heroes of Kauai. And Kauai is a recurring theme. And I one of the big arguments we were having, on Oahu, all throughout this, was okay. What are the models? What are the successful models around the world? And it became pretty clear as early as like March or April of 2020 that the CDC and the federal government of the United States was not going to be one of those successful models. So I pretty quickly jettisoned from my mind my fixation on what does the CDC say. And I started looking around, and we were looking at what are they doing in Korea? What are they doing in Singapore? What are they doing in Japan? What are they doing in Vietnam? And one of the things we started saying was, well, what are they doing in Hawaii? And I think that's part of the story of Hawaii's success. And it's a somewhat inconvenient one for the political class in Honolulu. I don't think they're entirely comfortable with this, that Hawaii did as well as it did, because a lot of people were saying, well, we couldn't possibly do that well. And then here's a county that did, right? So I think that's the theme in the book.
Right on.
I'm excited. I'm excited. Doc, what I think Charlie and I will, I haven't even asked Charlie, but I know he won't say no. We'd like to buy 25 of your books. I'm not joking, signed, so we can give away 23 of them to our viewers over the next, it'll be cool, man. It'll be cool. And it will definitely, I think we can, for our viewers, I think our viewers, Doc, should get autographed.
Absolutely.
If they purchase and say, hey, we heard about your book from Mel and Charlie's show.
Oh man, it's a guarantee. And
yeah.
And hopefully we'll be able to all gather together. I don't know what the Book and Music Festival is going to look like. I hesitate to project forward to October, but I'm hoping that there will be a safe way for people to gather in the fall and afterwards, and we can make an event of it.
Well, you will be at Charlie's concert. At the post-pandemic concert that Charlie's going to put on here on Kauai.
Oh, yes.
You will definitely have your table set up with your 1,000 copies that you'll sell, and it'll go quite well.
Well, I like to say that, I tried writing a book once, and I know what you're talking about. And after the publishers got a hold of me, I mean, I must have written close to maybe about 500-600 pages. And when it's all said and done, because I graduated from Kamehameha, the book was only 3 pages thick. So it went from a really good book to a comic book. That's the book.
Boy, you had an aggressive editor. Yeah, I don't know what to say. I mean, if you want to get rich quick, there's better ways to do it than saying you're going to write a book. That's one thing I definitely learned this year. I mean, God bless all the entrepreneurs who have innovated their way through COVID. I'm here. I am writing a book, and the publishing industry in the United States, it's a grim landscape. That's one of the things I learned. But fortunately, I had some good people that really helped me through it, that I'm grateful to. Including you guys.
Well, we cannot wait, Doc. I really, I mean that, man, genuinely, sincerely. You have been one of our guests that we just look forward to. I know you're a busy guy. You're working on your book, and that's why we couldn't get you on any earlier. But as we wrap up and get close to the end, Doc, what do we do? What if your final message to our viewers for tonight? What can we do going forward, knowing that this variant is here, it's aggressive? What can we do?
I mean, I think the principles still apply. I think we still need to continue to do public health. I'm supportive of any border control policy that will keep it out. I think it's premature to take masks off indoors. We still have segments of the population that we can vaccinate that haven't had the opportunity to get vaccinated yet, in particular children. We need to see what the data is on children, because it's a little bit more of a complicated situation, especially with younger kids, the risk benefit. We got to see all that and work it through. But I wouldn't give up yet on basic public health and infection control and border control. I think the mask wearing indoors is still important. It's definitely keeping a lot of people from getting sick. And the vaccine, although it's not looking quite as stellar as it was a few months ago, it's still, by historical standards, a pretty awesome vaccine. Remember, the number one thing I said is it keeps you from being dead, and it keeps you from killing other people to a large extent too. So those are good qualities. So I'm still working on my friends and family members that have gone down various disinformation rabbit holes. It's best not to have angry, confrontational conversations with people. It doesn't work. But if you can approach people in a gentle way that you're concerned about and express it as concern for them, I think it is helpful. And what I find is most people that have not gotten vaccinated so far, it's not some ideological hostility. It's that they're worried about it, and they read something that was, misinformation and that got stuck in their head. And a lot of them kind of, I suspect, want to be talked down from that, but don't really know how to. So I've had some success just having open conversation with people and then going back to it. Hey, I'm still worried about you. It wasn't just a one-off, So I think we need to get a higher number. 60% ain't going to cut it for any variant. It's got to be 80, 90%. And I realize that that's hard, but that's where we ultimately need to get. And that's where we are for like childhood vaccination. I mean, so we need to ultimately get to that level. And until then, I think we need to just keep doing smart things. Let's not allow the politicians to grip control of all the disease response. Let's stay focused on knocking the thing down.
Man, they need to get you on the local news, Doc. They really do, because that is, I think, your message is really validated by so many other experts around the country, around the world, and that's not what's being heard by our local residents here in Hawaii right now, and that's the scary part. On a side note, Kokei Museum, which is one of our gems here on Kauai, Chris Faya wants to keep her in a loop. Just Kokei Museum. They carry a lot of local interest books up there for our residents and visitors. So that might be one of your outlets here on Kauai. That'd be a really good one. So Chris Faya, thanks, Chris. Charlie.
Well, I
want to talk to this guy all night long, but I want to be respectful of his time. This guy just he makes me feel good, man.
Well, I would like to say, first of all, thank you so much, Doc, for joining us tonight. It seems like it was only about maybe a little over a month that you were with us last, but it seems like a lifetime that you weren't with us. But it's always good to have you on. You share the most updated information in a way that we can all interpret it and feel good, knowing that we got some information to arm us with what we need to do. So I want to thank you very, very much. To our viewers out there, again, when the opportunity arises to get really solid information, he was very candid. Our guest was very candid tonight. He saw the positives about the vaccine, and he also shared about some of the downsides of the vaccine and why we have to continue hygiene, wearing our masks. Because, for someone who works at the airport and I see the thousands of people that come in every day, I have to say this, and I always give credit where credit is due. The people that are arriving, I see a lot of them and they're wearing masks, and that makes me happy. My personnel don't have to go up to them and say, "Hey, put on your mask," because who wants to be told to put on their mask, right? If you just do it as second nature, then we all can be happy. And I just want to thank those people arriving, even though it's putting a strain on. It's causing the economy to go up, but it's putting a strain on our roads and stuff. But just being safe in that aspect, I appreciate it. So to our viewers out there tonight, we don't know when we'll get this expert on with us again, but I can tell you one thing: when his book comes out, let's let the world know that we are very grateful here in Hawaii for having someone put out such good reading material. And I urge all of you, yes, there's a lot of things that Mel said that I don't agree with, like such as running for governor. I didn't say that, he did, but I didn't say that. But yes, I agree with him on getting that 25, maybe even more books when it's ready, and we'll give it out to her. We have a lot of faithful viewers, and this show would not be possible without them. So to all of you out there, we love you, and I just want to thank our guest tonight because I can't thank him enough. And I know he'll be on again, and hopefully CNN and all those other guys just get a little glimpse at what this hometown guy here on the big island of Hawaii has done, and he's making a difference. So thank you.
Mahalo, guys. Thank you.
I just got chicken skin. Chris Faya from Kokei Lodge, Kokei Museum, said that she would put your books next to the Queen Emma's story. That is
That's humbling. That's humbling.
That is chicken skin, man. Chicken skin. Doc, thank you. I want to thank you for starting off our show on a positive note. Let's all understand that the vaccine, the protocols that are in place, especially for us on Kauai, have worked in keeping the illness and the deaths down. That is a fact, and we need to acknowledge that. For those of you that haven't gotten vaccinated, please seriously consider it. Like Charlie and I have said, we respect and love all of you, even if you choose not to take it. But for those of you that are on the fence, or if tonight didn't convince you, then I really don't know what to say. Doc, you've always been a great guest for our show, and I thank you for spending the time with us tonight, making it clear for us to understand. I think the news, Hawaii News Now, all of these guys, they watch our show after the fact, and I'm hoping that tonight's show they'll do a story, they'll do a clip, not for me and Charlie, but for the message that you gave our viewers. It needs to be shared really with the state, and especially with our politicians and decision makers. I think it's critical. So I'm going to try and nudge a couple of my close buddies up at the news channels to at least check it out. Continue to do what you do, Doc. We appreciate all that you do for the community there on the Big Island, as well as throughout the state. We truly appreciate you. Viewers, we thank you guys again. We are trying, again, we told you guys we're going to go down to once a week, but with what has occurred with the numbers spiking, and we are looking possibly getting Dr. Miskovich back on, maybe even Dr. Jerome Kim. We will let you guys know in advance so we can get you guys on. All right, guys, you guys all have a wonderful evening. Stay safe. God bless. We'll see you guys soon. Aloha.
Aloha.
Aloha.